Declaration of Helsinki contains history, introduction, basic principles of all medical history. Adopted in June 1964, has undergone 6 revisions, 2 clarifications. First significant effort by medical community to regulate research. Prior to Nuremberg Code, only specific countries had national policies forms basis of most subsequent documents. Introduction. The World Medical Association has developed the Declaration of Helsinki as a statement of ethical principles for medical research involving human subjects, including research on identifiable human material and data. It is the duty of the physician to promote and safeguard the health of the people. The physician's knowledge and conscience and dedicated to the fulfillment of this duty. The primary purpose of medical research involving human subject is to understand the causes, development, and effects of disease and improve preventive and diagnostic therapeutic interventions. Medical progress is based on research that ultimately must include studies involving human subjects. Populations that are underrepresented in medical research should be provided appropriate access to participation in research. Principles for all medical research. It is the duty of physicians who participate in medical research to protect the life, health, dignity, integrity, right to self-determination, privacy, and confidentiality of the personal information of research subjects. Medical research involving human subjects must conform to generally accepted scientific principles, be based on the thorough knowledge of the scientific literature, other relevant sources of information, and adequate laboratory and appropriate animal experimentation. The welfare of animals used for research must be respected. Appropriate caution must be exercised in the conduct of medical research that may harm the environment. The design and performance of each research study involving human subjects must be clearly described in the research protocol. The protocol should contain a statement of ethical considerations involved and should indicate how the principles in the declaration have been addressed. The protocol should include information regarding funding, sponsors, institutional affiliations, and other potential conflicts of interest, incentives for subjects, and provisions for treating or compensating subjects who are harmed as a consequence of participation in the research study. The protocol should describe arrangements for post-study access by study subjects to interventions identified as beneficial in the study or access to other appropriate care or benefits. Medical research involving human subjects must be conducted only by individuals with appropriate scientific training and qualifications. Research on patients or healthy volunteers requires supervision of competent and appropriately qualified physician and other healthcare professionals. The responsibility for the protection of research subjects must always rest with the physician or other healthcare professional and never the research subjects, even though they have given consent. Every clinical trial must be registered in publicly accessible database before recruitment of the first subject. Medical research involving a disadvantaged or vulnerable population or community is only justified if the research is responsive to the health needs and priorities of this population or community, and if there is a reasonable likelihood that this population or community stands to benefit from the results of the research. Every medical research study involving human subjects must be preceded by careful assessment of predictable risks and burden to the individuals and communities involved in the research in comparison with foreseeable benefits to them and to other individuals or communities affected by the condition under investigation. Thank you.